I did not invent this. God invented this.
What if a single injection could wake up your immune system, teach it to recognize cancer, and help keep it from coming back? Cancer treatments haven't changed much in decades. Most therapies still try to kill cancer directly, but they also damage healthy cells. Dr. Patrick Soon-Shiong, a surgeon, scientist, and biotech billionaire, asked a radical question. What if we don't attack cancer, but instead wake up the immune system that already knows how to destroy it? That question led to one of the most talked about breakthroughs in cancer immunotherapy. Dr. Soon-Shiong believes cancer is not just a tumor problem. At its core, cancer is a failure of the immune system to do its job. Instead of trying to poison cancer cells directly, his breakthrough approach focuses on something radically different. A therapy designed to activate your body's own defense system. This drug, often discussed as part of his immunotherapy platform, is built to supercharge T cells and natural killer cells, the immune system's most powerful cancer-fighting forces. Rather than weakening the body like traditional chemotherapy, this approach aims to train the immune system to hunt cancer with precision. In this video, we break down the groundbreaking cancer strategy of Dr. Patrick Soon-Shiong, billionaire scientist, medical doctor, and founder of multiple biotech and healthcare companies.
I did not invent this. God invented this. I realized that we have in our body a cell that God created, and it is 450 million years old, called the natural killer cell. And that cell was only discovered in the 1970s, and I wrote my first paper in the 1990s. And what this is the enlightenment of how do we activate the cell that God created in us, and why does the cell exist? And this cell exists because it is here to prevent us from having cancer. This cell exists is to prevent us from dying from an infection, from sepsis, from COVID, from bacteria, from fungus. What's happened now is an enlightenment after 30 years of work of how to activate that cell with a single jab.
He was born in South Africa and trained as a medical doctor and surgeon. Early in his career, he noticed a big problem with traditional chemotherapy. While it can kill cancer cells, it often harms healthy cells too and causes severe side effects. Dr. Patrick Soon-Shiong's newest breakthrough is a cancer treatment called Anktiva, and it works very differently from traditional chemotherapy. Instead of trying to kill cancer cells directly, Anktiva focuses on waking up your immune system and helping it do what it was designed to do all along. You can think of it like this. Your body already has a built-in security team. These are immune cells called T cells and natural killer cells. Their job is to patrol your body, spot dangerous cells, and eliminate them before they cause harm. According to Dr. Soon-Shiong, cancer develops when this security system falls asleep or gets confused. The cancer isn't stronger, it's just better at hiding. Anktiva acts like an alarm bell. It's an injection that sends a powerful signal telling your immune system, wake up, multiply, attack cancer. Dr. Soon-Shiong often explains that these immune cells aren't new inventions. In fact, natural killer cells have existed in the human body for hundreds of millions of years. As he puts it, I didn't invent this, nature did. His work is about finding the on switch that turns these defenses back on. So, how does Anktiva actually help? In simple terms, it boosts the number and strength of cancer-fighting immune cells in your bloodstream. Once activated, these cells spread throughout the body, searching for cancer cells and destroying them with much more precision than traditional chemotherapy. Dr. Soon-Shiong describes this immune signal as the switch that flips your body from passive mode into attack mode. Rather than weakening the body to fight cancer, Anktiva is designed to strengthen the body first and let the immune system lead the fight.
We have within our body this immune system that's been around. Everybody understands T cells, everybody understands, but nobody ever thought about the word natural killer cells, and that's the name of the cell. It's the natural killer cell. It is the first responder in your body to recognize anything that's dangerous and kill it. That's the only way that mammalians actually evolved to live today. What this is really is an enlightenment of going from toxic chemotherapy radiation to really using your body itself as the protector against cancer.
If you could zoom in far enough inside the body, this is what the immune system in action actually looks like. Those small green dots you see are T cells, powerful immune cells whose job is to hunt down dangerous cells. In the image, they're attached to a larger blue cell, which is a cancer cell. The T cells latch on and release tiny bursts that punch holes in the cancer cell until it breaks apart and dies. This is the immune system doing exactly what it was designed to do. Immunotherapy is all about helping these immune cells work better, faster, stronger, and in greater numbers, so they can find and destroy cancer wherever it's hiding in the body. Imagine watching an animation where glowing immune cells swarm a tumor, and the tumor slowly shrinks. That's the goal of treatments like Anktiva, to empower the body's own defenders to clear cancer naturally. Chemotherapy works very differently. It's more like a carpet bomb. It attacks cancer cells, but also damages healthy cells nearby, which is why patients often experience harsh side effects. Anktiva takes a more precise approach. Instead of bombing the whole area, it's like giving the immune system's special forces better equipment, clearer vision, better communication, and the tools they need to take out the enemy with accuracy. Rather than fighting the body to fight cancer, immunotherapy helps the body fight for itself. How is this different from chemotherapy? Traditional cancer treatments like chemotherapy and radiation go straight after the tumor. They use powerful chemicals or high-energy rays to kill fast-growing cells. While this can destroy cancer cells, it also damages healthy cells that grow quickly, like hair, skin, and cells in the stomach and immune system. That's why chemotherapy often causes side effects such as hair loss, nausea, extreme fatigue, and weakened immunity. It's a bit like using a sledgehammer to crack a nut effectively, but rough and hard on everything around it. Dr. Patrick Soon-Shiong points out that this approach can be short-lived and risky because it may weaken the immune system at the same time it attacks the cancer. How immunotherapy is different. Immunotherapy, including treatments like Anktiva, takes a very different approach. Instead of attacking cancer directly, it helps your own immune system do the fighting. Think of it as waking up and strengthening the body's natural defense force. Here's what makes it different. Targeted attack. Chemotherapy acts like a general poison. Immunotherapy boosts immune cells like T cells and natural killer cells that already know how to recognize cancer. Anktiva doesn't attack the tumor itself. It helps these immune cells find and destroy cancer cells more effectively. Fewer side effects. Because immunotherapy doesn't attack every fast-growing cell, it may avoid many of chemotherapy's harsh side effects. Many patients don't experience hair loss or organ damage. Some people may feel flu-like symptoms, fever, chills, or aches, which are signs that the immune system is becoming active. Immune memory. One of the biggest advantages is memory. Once your immune system learns what cancer looks like, it can continue watching for it. This memory may help prevent cancer from coming back, similar to how vaccines train the immune system. Chemotherapy offers no such protection once treatment ends. Dr. Soon-Shiong believes cancer isn't just a single lump to be destroyed. It's a whole body problem involving a weakened immune system. So instead of repeatedly blasting tumors, he argues it makes more sense to fix the immune system itself. He often describes this shift as a new chapter in medicine, moving away from toxic treatments and toward using the body as a precise, intelligent weapon against cancer. Real progress and what's still being tested. You might be wondering, this sounds promising, but does it actually work in real people? The encouraging news is that this treatment isn't just a theory or a lab idea anymore. Anktiva has already shown real results in patients. In 2024, the U.S. Food and Drug Administration approved Anktiva for a specific type of bladder cancer, non-muscle invasive bladder cancer, that didn't respond to standard treatments. This made it the first FDA-approved immunotherapy designed specifically to activate natural killer NK cells to fight cancer. That approval came from a clinical trial involving patients who had run out of options. Many were facing the possibility of having their bladder surgically removed. Instead, doctors injected Anktiva directly into the bladder, alongside an older immune treatment. The results were striking. About 62% of patients saw their tumors completely disappear. More than half of those patients were still cancer-free 1 year later. Many remained cancer-free 2 years later. For people who were staring down life-altering surgery, this meant keeping their bladder and their quality of life. That's why doctors consider these results such a big deal. Dr. Patrick Soon-Shiong believes this immune-based approach could work far beyond bladder cancer. His team has been testing similar immune-activating treatments in lung cancer, breast cancer, pancreatic cancer, aggressive brain tumors like glioblastoma. He points to years of research and multiple trials suggesting improved survival in some patients. Because the treatment boosts the immune system rather than targeting a specific tumor type, he has described it as a possible universal cancer strategy, one that could apply to many cancers. That said, it's important to be honest. Not every trial has been a clear success. Some studies, including one in advanced lung cancer, did not show the survival benefits researchers hoped for. Because of this, regulators have been cautious. While the FDA approved Anktiva for one narrow bladder cancer use, it has not yet approved it for other cancers, saying more data is needed. Many scientists agree. Larger, carefully controlled studies are still required to confirm how well this immune boost works across different cancers and patients. What's happening now? Dr. Soon-Shiong continues to push forward. In fact, Saudi Arabia's health authorities recently approved Anktiva not only for bladder cancer, but also for lung cancer, allowing broader use there while studies continue. He has described this as a sign that medicine is entering a new era, one where the immune system plays a central role, and has expressed frustration that wider access in the US may take longer. As of today, Anktiva is FDA approved, but only for certain bladder cancer patients. For other cancers, it is still being studied in clinical trials. It is not a universal cancer cure, and it's not available for everyone. But it is a real, approved therapy that represents a major step forward in cancer immunotherapy. Each new trial adds more knowledge, and so far, the results suggest we're moving closer to treatments that work with the body, not against it. If Dr. Patrick Soon-Shiong's vision becomes reality, it could completely change how the world treats cancer. Every year, nearly 10 million people die from cancer worldwide. Now imagine if many of those lives could be saved or extended with a simple injection that activates the body's own immune system. That kind of treatment could make cancer care more accessible than ever before. Today's cancer treatments like chemotherapy and radiation require major medical infrastructure. They depend on large hospitals, expensive machines, trained specialists, and long treatment schedules. They also cause serious side effects that need constant medical support. In many parts of the world, especially in poorer or rural regions, access to these treatments is extremely limited. An immune-boosting injection could change that. Instead of needing high-tech facilities, such a treatment could potentially be given in a basic clinic or outpatient setting. It's far easier to distribute a vial of medicine than to build radiation centers in every town. That alone could open the door to cancer care for millions who currently have no access at all. There's also the cost factor. If a treatment causes fewer side effects, patients may need fewer hospital visits, fewer medications to manage pain or nausea, and less time recovering. That could make cancer care more affordable and allow patients to return to their normal lives sooner. For developing countries, where cancer rates are rising fast, this could be truly life-changing. Dr. Soon-Shiong's work is also shifting how scientists think about cancer itself. Instead of seeing cancer only as a tumor to destroy, he encourages doctors to treat it as a problem with the immune system. That idea opens the door to prevention, not just treatment. One day, it may even be possible to train the immune system ahead of time, similar to a vaccine, so it can recognize and control cancer early. Researchers around the world are already exploring personalized cancer vaccines and immune training therapies, ideas that closely align with this vision. Beyond science, Dr. Soon-Shiong has also pushed for global fairness in healthcare. He has invested in medical and vaccine manufacturing in Africa, including his home country of South Africa, and frequently speaks about making sure life-saving treatments aren't limited to wealthy nations. If a one-shot immune-based cancer treatment ever becomes widely available, he's one of the few people with both the resources and the motivation to push for global access, not just access for those who can afford it. We started with a big question. What if one injection could cure cancer? Thanks to innovators like Dr. Patrick Soon-Shiong, that question is no longer just science fiction. It has become a real area of scientific research. In labs and hospitals around the world, doctors are now testing treatments that use the body's own immune system to fight cancer. We've already seen real examples where a single immune-based injection helped patients with bladder cancer go into remission. These early successes suggest that similar approaches could one day help treat many other types of cancer. That said, this story is still unfolding. Major medical breakthroughs don't happen overnight, and skepticism is healthy. Some experts rightly point out that we need larger studies and more long-term data before making bold claims. But with every patient who responds well to immunotherapy, confidence continues to grow that something important is happening. Dr. Soon-Shiong often says his goal isn't just to treat tumors, it's to repair the immune system. It's an optimistic idea that our bodies already have the tools to fight cancer, and science just needs to help unlock them. This way of thinking is inspiring researchers worldwide to look for treatments that are smarter, gentler, and more precise. Now imagine a future where a cancer diagnosis doesn't automatically mean months of painful chemotherapy. Instead, it could mean a simple injection and the knowledge that your own immune cells are now actively hunting the disease. Families could share more survivor stories, and hospitals could focus less on managing side effects and more on true recovery. We're not fully there yet, but we're closer than ever before. Dr. Patrick Soon-Shiong's vision of a single immune-activating shot has sparked real hope and serious science. As research continues, the world is watching closely. Could this be the injection that changes cancer treatment forever? Only time and careful science will tell. But for millions of people, the hope it represents is already very real. Thank you for watching. If you found this overview eye-opening, hit the like button and subscribe for more stories of cutting-edge science, turning hope into reality. Together, let's keep imagining and working toward a future where cancer is finally conquered, perhaps with just a simple shot.